ketogenic diet, and the topic of my talk is, should everyone be on a ketogenic diet? For those that don't know what a ketogenic diet is, I'll explain it a little bit. It's really an extension of a low-carb, high-fat diet. So in this talk, I'll just basically run over the basic biochemistry, tell you a little bit about what it is, the benefits, possible health benefits of ketosis. I'll touch on a little bit about exercise performance and ketosis, but I'm sure Peter will expand on that in his talk, and some of the criticisms, and then we'll end with a conclusion. So just a tiny bit about me. Like Rod said, a GP in Melbourne, a couple of other hats that I wear. So starting with a simple graph here. So after we eat, what happens with the food? So the macronutrients, we've got carbohydrates, protein and fat. So this graph shows what happens to your sugar level or your glucose level after a meal, and you can see that carbohydrate gives you the biggest spike, and protein a little bit of a increase, and generally fat keeps your sugar level very stable. So insulin, so this is a representation of a pancreatic cell. So when there's an increase in glucose in the bloodstream, it comes through a receptor into the pancreatic cell, which starts a cascade of events which essentially leads to insulin being released from the cell. And at the cellular level, at the cell membrane, basically glucose can't get through the membrane without insulin's help. Insulin comes and binds to a receptor, which basically opens up a transport mechanism, and then the glucose can enter the cell and be used. What happens to the glucose? So the glucose can be used for energy by various cells in the body, or pretty much every cell in the body, and whatever's left over can be stored as glycogen in the liver, and this glycogen can be released later into the bloodstream to be used when dictated by the demands of the body. And glucose can also be stored as glycogen in the muscle. Once it's stored in the muscle, it's only for the muscle to use. It can't go back into the bloodstream. Okay, this is a little bit of a busy slide, but I'll break it down and explain it to you. So this represents a fat cell. Okay, so on the left side of the slide, you can see the mechanism in fat storage. So the TAG represents triglycerides. That's basically the three fatty acids with a glycerol body, and then you can have them in chylomicrons and VLDL. VLDLs are formed in the liver basically from sugar and carbohydrate metabolism. So in a system in the body, when insulin is high, it promotes the effects of lipoprotein lipase, LPL, which is an enzyme that breaks down the triglycerides into their constituents, and this allows these to enter the fat cell, and you see glucose entering the fat cell as well, and these combine in liponeogenesis, and that forms basically stored fat within the fat cell. In fat mobilization, when insulin levels are low, hormone-sensitive lipase breaks down the triglycerides, and the free fatty acids and the glucose can shuttle out and be used for energy. So the fatty acids bind to albumin in the bloodstream when they are released from the fat cell, and that's part of the reason the brain can't use fatty acids, because the albumin fatty acid complex is too large to cross the blood-brain barrier. So I hope that sort of all makes sense. Just shifting our focus to energy. I mean, we hear about this all the time in the community. We go, we're burning energy, and what is energy? So what energy is used for is to, basically most of it is to maintain body functions and keep the body alive, so the resting metabolic rate. So these include things like growth and repair, and these are things that are not under conscious control. So when the liver's doing its job, or you're having repair to cell damage, we're not in active control of it, and that's where most of the energy goes. There's the effect of food as well. And exercise and non-exercise activity make up probably a lot less of the energy expenditure in a day that most people go through. And what happens with this? So at a cellular level, ATP is produced, and when the ATP is broken down to ADP, basically you get energy, and that energy is used for those purposes. So going back to the glucose, so inside the cell, the glucose can form pyruvate. That happens in the cytosol of the cell, which is without oxygen requirements. And inside the mitochondria, you have a whole cascade with the pyruvate, you get acetyl-CoA, you get what's called the Krebs cycle, and essentially the end result is 34 units of ATP, and that's used for energy. And you can see on this slide that fatty acid through beta oxidation can also enter the Krebs cycle and form energy. So far we've established that glucose and fats can be burnt at a cellular level to create energy. This slide probably didn't come out as well as I want, but basically it shows that in a little bit more detail. And on the right-hand side, you can see the Krebs cycle and all the complicated steps that are involved in production of energy. So looking at the brain, it makes up about 2% of our body mass, but 20% of daily energy expenditure is used, of the body is used by the brain doing its job. The traditional thinking is that most of the energy comes from glucose, as I explained before. Most free fatty acids can't cross the blood-brain barrier. Depending on size and genetic variability, about 100 to 120 grams of glucose per day used by the brain, which coincidentally roughly is the same amount that the liver can store. So you can see a little bit of a problem developing there. If the brain only uses glucose, and if you don't eat for a couple of days, you should expect to be not able to function. But we've seen in people that go through starvation with just water that they can live for months and months. And yes, protein is broken down into amino acids, which can you can make some glucose in that process. But without an alternative fuel source for the brain, you wouldn't expect to survive very long. So we've got ketone bodies. Basically, these are produced in the liver. So when you have a situation where there's low insulin and a lot of free fatty acids in circulation, the liver will turn them into acetoacetic acid, which can either be formed into acetone, which is pretty volatile, and the body usually excretes it either through the urine or through respiration, through breath. But once you get efficient at forming ketone bodies, you mainly form beta-hydroxybutyrate. And strictly speaking, beta-hydroxybutyrate is not technically a ketone body, but for the purpose of this talk, we'll class it as one. And here we have what shows the ketone bodies. Beta-hydroxybutyrate can actually cross the blood-brain barrier and be used by the brain for energy. So basically, what I've shown here is that there is an alternative fuel source for the brain, and that is the beta-hydroxybutyrate. Funnily enough, the beta-hydroxybutyrate is probably a cleaner fuel source for the brain. There's less oxidative stress, and the mitochondria probably do their job more efficiently in producing the ATP. So essentially, I would say that it's almost a default state that we're probably designed to be in, because it's such an efficient system, rather than glucose. So just going back to that original slide of the Krebs cycle and how glucose forms pyruvate and enters this system, you can see down the bottom beta-hydroxybutyrate bypasses that and enters the Krebs cycle as well. And this summarizes nutritional ketosis right there. So in a setting where there's limited glucose and low insulin, fats are turned into ketone bodies, which are used by the brain and other organs of the body as well. You maintain your protein, so you don't break down your muscle at the same time. So the question is, how do you achieve nutritional ketosis? So essentially it's an extension of a low carbohydrate, high fat diet, which most of you are probably familiar with in this room. So there is individual variation to reach nutritional ketosis. So if someone's already quite metabolically broken, they're probably going to have to restrict their carbohydrate intake a fair deal more than others. So this is sort of based a little bit on myself, but 50 grams a day of carbohydrate should be enough to have the liver start making ketone bodies. Some people that are doing are on this way of eating that don't have any metabolic derangement can get away with more than that. Some people I know, there's a professional triathlete in America, I can't remember his name, but he can have up to 100 grams of carbs a day and he still enters nutritional ketosis. So the important point is also protein. So often people think of a low carbohydrate diet as a high protein diet. But you really want to keep protein to about 1 to 1.5 grams per kilogram of lean body weight, depending on your activity level, because the excess protein, which we saw at the original graph, will give you a glucose spike as well. And fat basically until you're full. So just quantifying a little bit more, the carbohydrate content is mostly vegetables, some fruit, nuts, seeds. I mean, I aim for no fructose or grains. I mean, some people have some tubers as well. I generally don't. So again, no gluten. Got to be careful with casein and whey. Certain people have problems with that. And when it comes to the fats, this is what's very important. Traditionally, ketogenic diets, they didn't really care about what type of fat as long as it was fat. So I think it's very important to mainly have the saturated and monounsaturated fats, because they are less inflammatory, more stable, and rather than ad hocly increase your omega-3, it's easy to bring your omega-6 intake down and try and get an ideal ratio of 1 to 1. So you have an anti-inflammatory and pro-inflammatory pathway. So the next question is, how do you actually know if you're in ketosis? So after a while you get the feel for it, but you can measure your ketone levels with these little strips. And there's a graph on the left that sort of shows what levels in your blood you think are ideal for ketosis. And often people confuse this with ketoacidosis, which is totally on the right-hand side of the spectrum. It's like comparing a drizzle to a hurricane, in my opinion. They're really poles apart, and it happens in a certain type of people, type 1 diabetics. This cartoon shows what happens in the pancreas in insulin resistance. So basically you've got too much glucose in the bloodstream, which means you need a lot of insulin to clear it. The pancreatic cells start working really hard and they get burnt out, and eventually no insulin's produced and the blood sugar level, glucose level just keeps rising and rising. And that hyperglycemia can lead to several problems. So you have inflammation, you have a procoagulant state, endothelial dysfunction, mitochondrial dysfunction, oxidative stress, and increased ages, which are advanced glycation end products. Again, insulin resistance leads to a lot of disease states, which I'm sure the other speakers will touch on later. And atherosclerosis, which is traditionally, a lot of people think that is too much fat, too much cholesterol swells around your arteries and causes blockages like a pipe in your kitchen. But you see here, there's a lot of factors in play. There's high blood pressure, inflammation, high insulin diabetes, high triglyceride levels, high levels of small, dense LDL particles that lead to atherosclerosis. So now that we've got through all that biochemistry, and hopefully most of you are still with me, what are the health benefits of a ketogenic diet? So there really is a lot of strong evidence in diabetes, and you probably saw from the stuff that I've just shown you, if you're keeping your sugar level, your glucose level in your blood stable by eating this way, you can actually reverse a lot of the processes that go in place in diabetes. Also, weight loss, with that representation of the fat cell, you have low levels of insulin, so you have fat mobilization. even cardiovascular risk parameters. I mean, most of the community these days, I mean, you would have seen the Catalyst programs, a lot of you, it's almost as if heart disease is just about cholesterol. There's all these other risk factors, and underlying inflammation is probably the biggest driver. Eating in this way actually lowers your triglycerides, which is the fat in your bloodstream, and makes your LDL particles larger, more buoyant, less at risk. And the low inflammation in the diet also means that there's less oxidation of the particles and less glycation through the sugar. Now, epilepsy is an interesting one. The ketogenic diet has probably been used since the 1920s for epilepsy, particularly in kids, and it worked really well. Once anticonvulsant medications were introduced, people thought it was easier to take a pill than eat this way. So it's still used a lot for patients that don't respond to medication, and the pathway is thought to be, as a result, like I said before, the beta-hydroxybutyrate, being a cleaner energy source, is less excitable to the neurons, to the brain cells, and from that way leads to less seizure activity. There's also some emerging evidence for other conditions. So acne is an inflammatory condition, polycystic ovarian syndrome, which basically in insulin resistance causes the ovaries to shut down and stop making the female hormones, estrogen and whatnot, and that leads to fertility and infertility and all sorts of problems through there. I'll touch on cancer in a moment. Neurological diseases as well through the neuroprotection. So the weight loss, if you have low insulin, you're going to be mobilizing more fat for an energy source. This is a representation of a brain tumor cell. In cancer, there's a lot of insulin receptors and insulin-like growth factor receptors. So basically, the cancer cells lap up the glucose. And the theory is, the Warburg effect is that the mitochondria are deranged and they can't really produce much energy. So in someone in ketosis, you starve the cell of glucose, the normal cell can still use beta-hydroxybutyrate. So that's some emerging evidence that you could actually shrink a cancer cell. Okay, so I'll quickly go through exercise performance. Does ketosis enhance aerobic capacity? Most likely. Anaerobic power? Probably not. Muscular strength? Unlikely. And muscular endurance? Probably likely. So I'll just skip through these slides pretty quickly, but this looks at different mechanisms of energy use in exercise. So it's really the right-hand column where you're doing long aerobic activity where you can constantly have a fuel supply. So if you're running on glucose, you've got a limited fuel tank. If you're running on fat, it's unlimited. I'll just skip through this. Basically, when you're burning fat, you're exhaling less carbon dioxide, and that reduces your respiratory drive. So there's some of the benefits there in a keto-adapted state. So better body composition, protein sparing, less oxidation, loss of oxidative stress and inflammation. Common criticisms of ketosis. So this is something that a lot of people will probably be familiar with. A lot of people say that a low-carb diet is mainly water and muscle loss rather than fat loss. I mean, you will be probably pumping out more water at the start, but you know, we've seen through the low insulin levels, you will be mobilizing fat. Now, people say carbs are critical. I've never heard of a disease that's called carbohydrate deficiency, and there's no such thing as an essential carbohydrate. All the things you get in carbs, you can get in other sources. You eat a piece of meat, there's going to be glycogen in that meat anyway, so you're going to get a little bit of glucose that you need. Saturated fat, cholesterol, heart disease theory, one risk factor that's not even proven to be connected. So, you know, you can have a detailed conversation about that. Ketosis versus ketoacidosis I've touched on, totally different spectrum of conditions. Missing micronutrients. most vegetables. Organ meat will have more than enough micronutrients that you'll need. Short-term versus long-term usage. A lot of hunter-gatherer societies probably were in a ketogenic state, particularly the Eskimos. So there is some anecdotal evidence there. Red meat causes bowel cancer, and this is a big one. People fear red meat. But I think a lot of the studies that were done were poorly designed. There was no definition of what red meat was. Often sausage rolls and pizzas with meat on them were tied together in this study. And they didn't look at what the meat was eaten with and what oil they were cooked with, like seed oils and those sort of things. Kidney disease, people think a high-protein diet can cause kidney disease. This is not a high-protein diet, and if your kidneys are functioning quite at a normal level already, then I wouldn't worry about a little bit of higher amount of protein. There's no sort of concrete evidence behind that. It's expensive. It's cheaper than diabetic medications, high blood pressure medications the rest of your life, so that's pretty much a no-brainer. I flip that around and say if you're on a low-fat diet, you're not going to be using that bile. There's no need to secrete that bile out of the gallbladder. So all that bile will actually do is sit there in the gallbladder, and that stasis is what actually will form gallstones. So it's an interesting way of thinking about that. Now, a lot of you would have heard about adrenal fatigue as well. Now, correct, you will put yourself under stress if you decide to go in ketosis, intermittently fast, do sprints and CrossFit all on the same day. I mean, it's a graduated thing. You got to sort of slowly get your body to adapt to this. And once you get into a bit of a rhythm with all of this, certainly there shouldn't be too much adrenal fatigue. I mean, a lot of that varies with person to person. And look, the other thing is socially unacceptable. And looking out in the room, there's 300, 400 people here that are keen to learn about this. So I think this is slowly changing, and there's a lot of low-carb friendly places or paleo-friendly places popping up all over the place. So, it's going to be less of a challenge, I think, in the future. So to summarise, I can see Rod giving me the wind-up down there. I'm probably over my 20 minutes. But who should be on a ketogenic diet? Or who should be in nutritional ketosis or a low-carb, high-fat diet? Now, this is what I think. Definitely diabetics, people with high blood pressure, overweight, high triglycerides, metabolic syndrome, epilepsy, and also some disorders of carbohydrate metabolism, such as the ones you can see there. Probably or possibly, I certainly think there's a role to play in neuroprotection here. We touched on how beta-hydroxybutyrate is a clean energy source. So people with dementia, Parkinson's, ALS, brain trauma, stroke, migraine, ADHD, autism, MS, well, there's not studies for all of these things. I certainly think there's no harm in trying a ketogenic diet in these disease states and seeing if a difference can be made. Certainly polycystic ovarian syndrome, I think, could be very beneficial. Acne, cancer we've touched on. Irritable bowel or inflammatory bowel disease. Now, I didn't get time to talk about gluten and its role in causing a lot of bowel issues and bowel symptoms, bloating, abdominal pain, irregular bowel habit, and certainly the role of bacteria, gut microbes in all of this as well. But certainly people that eat in this way find that their bloating goes and they just go, wow, I never knew that was a problem there before. I just thought that was normal. Autoimmune disorders, likewise, when you're putting something such as, use gluten for example, again into your body, the immune system is overactive. It confuses gluten and its own parts of its own body and starts attacking itself. What we do to treat is just give immune suppressants, so rather than look at what's causing that. Osteoarthritis, I think there's a role there. I'm sure Gary would be able to expand on that later, but weight loss and an anti-inflammatory component to this. And look, if adherence is possible, it's worth trying for things like bipolar, schizophrenia, some other mood disorders as well. Now, the only people that I say we definitely shouldn't eat in a low carbohydrate, high fat diet, rare conditions like porphyrias, pyruvate carboxylase deficiency, and genetic disorders of fat metabolism. So that's a quick snapshot of a ketogenic diet and whether everyone should be on them. Apologise for all the biochemistry, but I just thought it'd be good to lay down a foundation to actually explain what happened. So that's just me. I just want to show off. little bit of a difference there between a few years, so the proof is in the pudding there, so to speak. Thank you.